current status for children with spinal muscular atrophy, SMA, is rather depressing. Children with SMA, and there are different types, up to 5 types, but the ones we see commonly are 1 and 2. They can't move at all. They just cannot move. But they have a normal brain, usually. So they're kind of locked in and sit on the bed and do nothing. And up to now, until maybe 2 or 3 years ago, our recommendation on the intensive care was to let them pass away and die, certainly in England and in North America. And that was the state. More recently, there's been very interesting research coming out, genetic research and biotechnology, which has given hope, I think, to a lot of children with SMA. It's very common. 1 in 40 adults carry the gene, recessive gene, and particularly in the Middle East, it's quite a common disease. So at the moment, there still is no absolute treatment, but over the next year or 2, there may well be some treatment. So for the time being, what we do, and that's why I've come to this meeting to show what we've managed to achieve at the Portland Hospital, is we make their quality of life much, much better. So whereas children used to sit in beds and they used to get bed sores and be very, very bored and not put on weight and die by the age of 18 months, now we're getting children up to 5, 10, 15 years of age. And we give them lots of good physiotherapy, occupational therapy, and all the technologies we have, eye-centered movements with the laptops and things. They're able to communicate. So actually the quality of life is much, much better. Well, a lot of it is genetic based, either gene insertion with viruses. So you link the gene that is missing in spinal muscular atrophy and you put it into a virus, an adenovirus, and then you put that into the child. And so they actually insert the gene for SMA. Now, they've only done that in mice so far, but of 60% of the mice that get it actually move around again. So it's really quite exciting that if it can be moved into human beings, you have to do it very early though. The mice, it's almost at birth. But there are other treatments. You can use oligonucleotides or little gene insertions that can give you back, not the whole gene, but some small bits of the gene that are missing. And that has been shown in humans, and I was going to talk about the studies today. Some company called Biogen in Boston, Massachusetts, Cambridge, Massachusetts, has released some early data that even the children who are born at 6 weeks can get some movement and then don't need to be on a ventilator. So it's really quite exciting time. And that new drug is going to come out, Nusinersen it's called, it's coming out in maybe a year or so's time. So it's really very promising. So in the meantime, what we can do is to make these children, give them the best quality of life they can. It may be too late for them, but even so, children of 3 and 4 years old have benefited from Nusinersen. They can walk a little bit more. So, but in the meantime, we can make their lives so much better. Quality of life, good feeding, nutrition, take them out to the park, to the zoo, mix with the families. Whereas before they used to be just put away and left and sadly died. Now they're living till 20. Well, globally, I think, and regionally too, how we manage these children is not to give up on them. I think whereas in the past, 5 years ago, people would say there's nothing we can do and write them off. And I think now, this day and age, 2016, I don't think that's acceptable anymore. So I think you've got to put a lot of input into it and make the child's life, quality of life, as good as you can. Physiotherapy is important. They mustn't get contractures. Stimulation. They can go to school. Just because they can't move doesn't mean they can't think. Two reasons. I think, as I said earlier, there is a higher incidence in the Middle East of SMA. So that's important to spread the word that quality care is important, either here or anywhere in the globe. But also globally, I think this condition may well be treated. So it's very important that to know. But this conference brings people from all over the Middle East, certainly in Dubai, and it's an international conference, well known. So I think it's important to highlight the developments that are occurring, and people should be interested.